Hi, Emily.
Hey, Megan.
So we thought that today we'd talk about what goes through our head when our patient says they're having a hard time breathing. And so I know you have patients who come in with having a hard time breathing as part of the constellation of their symptoms. And as a lung specialist, basically that's what most of my patients will have and my colleagues. And so when I see somebody who has a hard time breathing, I'm very often thinking immediately about their lung tissue and whether their lung tissue is functioning. So we usually use a pulmonary function test, which is a test where you're breathing in and out of a tube and you're measuring dimensions of the lung to see whether there's something wrong with their breathing via the lung. And if there isn't, we'll look at other things like their heart, or we'll look to see whether they're deconditioned, or we'll look to see whether they have anemia and some other thoughts in the differential diagnosis of the cause of a hard time breathing. But I'm curious about, from the mental health expert's viewpoint, what do you think about?
No, I mean, I think, first of all, it is just interesting to get the medical side because, again, a lot of times people have been cleared by their doctors, but it's very rare that I actually get to talk to them. And so I always kind of wonder what have they been cleared for? What's okay? So it's helpful for me to hear that. But so pretty much what I think of is I start to think about kind of roughly what is going on for the person leading up to that moment, in that moment, and then after that moment, or maybe where they're having a symptom. And so what I want to start to learn about and start asking about is history of trauma, and sort of maybe any time that maybe they've had an experience that they're pretty clear they remember about. They may not call it a trauma, but I'm going to be, I'm using kind of the clinical definition of trauma, sort of like you're having symptoms after a major event that kind of aren't going away. Um, and so I'm going to ask them about, if they have any kind of experiences as a child, as a baby, recently, even things that maybe they didn't think were a big deal, um, that maybe other people laughed at, or, that it wasn't a big deal to them in the moment, but it kind of stuck with them. I'm also going to be curious about what their fears are. So like when that happens, what kind of thoughts are coming in. So
Mhm.
that's where we start to kind of play around with like kind of how we break it down. Kind of we look at this like bigger, essentially it's a functional analysis, but we look at kind of what's going on for the person. And we do it by breaking it down into the trigger and then the thoughts, sensations, emotions, and behaviors. And the idea in behavioral therapy and cognitive behavioral therapy, ACT, any, acceptance and commitment therapy, any of those, is that roughly what we're experiencing every day is just an interaction
Mm.
within our thoughts, our sensations, our emotions, and our behaviors.
Let me say
And
that again. So
yeah,
it's
go ahead.
the thoughts, the sensations, the emotions, and the behaviors. And so, like a thought being what, for example?
So a thought, and this is something that like I would eventually have somebody really learn to like tune into, because a lot of times it's just happening all the time. So
Hmm.
we want to think about thoughts as, sometimes people think in images, some people think in like words or sounds, but generally it's going to be a thing like, not this again,
Mm.
or oh shoot, this is happening, or oh, well, this is going to ruin my night,
So my
or
breathing, like I can't breathe
mm-hmm,
again. I'm
mm-hmm,
struggling to breathe
mm-hmm.
again. Uh-huh.
Yeah, what caused this? Like, and someone's going to have maybe 800 thoughts all at once, but those are the ones that are going to be the loudest. Those are
Mm.
probably the ones that they've had before. Those are bait, and those will reveal a lot about kind of like the bigger context and these narratives and the beliefs that are kind of influencing the person's symptoms, and kind of at least the mental health symptoms around the physical
Mm.
symptoms, and often are all the same thing. Um, and we one thing to say about kind of like thoughts, sensations, emotions, and behaviors is that they're kind of all happening interchangeably. There's kind of a feedback loop
Mm.
kind of within all of it. But if we want to just think about the thoughts, like we imagine that the thoughts might be coming in and you're having those thoughts.
Mm.
The sensations are usually the ones that are kind of the loudest in our mind. So if you're having trouble breathing, maybe that tight feeling, or like that burning, or the
Mm.
gasping feeling, or kind of that cold feeling in your lungs, or tightness or pressure. maybe you feel like tingly in your hands and feet or in your lips, or like kind of that like kind of tightening,
Mm.
like that can happen. You might be feeling very sleepy. You might be feeling very, very awake and very focused, like sensationally.
Mm.
And we want to break that down too, because our body is essentially giving us all of this information, but we've been trained to really disregard it because it's very inconvenient. It's very frustrating to feel
Yeah.
sensations when we don't want to, but it's communication and it's very informative. And sometimes it's because there's a little bit of a habit around it, but generally we want to help people understand the sensations that are happening. A lot of
Mm.
times too, sensations can be very, very scary and very overwhelming. And so we tune them out, not only because they're inconvenient sometimes to what's going on, but also if we pay attention to them, sometimes they get worse, and that's really scary. And for a lot of people, it's like they just have to kind of pull out. Their bodies felt dangerous, or it's been a very scary place to be in. So pulling out of their body is adaptive, but it's also something that we then need to kind of help them kind of come back in and start to feel the sensations.
What do you
And
mean
then,
by pulling out? You mean like ignoring it or being kind of at a different level, like just
yeah,
dissociating from your body feelings?
yeah,
Uh-huh.
yeah, yeah, just kind of not feeling, a lot of people will just say, like, I feel like a, a walking head, like I don't really feel much.
Mm.
Um, and, or they feel all the time and they just have to kind of turn it off, by using substances or just zoning out or finding other distractions. But yeah, kind of cueing back, like kind of feeling those sensations and really sensing them and understanding them and learning to stay with them it's a skill that can be incredibly helpful. Um, and then the emotions are also just going to be the emotions that we're experiencing, kind of those feelings of sadness, anger, embarrassment, shame, loneliness. And I notice that a lot of times when people have trouble breathing, it's these feelings of anger, frustration, fear,
Mm.
sadness, and hopelessness. It's a lot of hopelessness, a lot of like, this isn't going anywhere. This isn't going to get any better. And then it's these
Mhm.
kind of hopeless feelings about their future and what they're going to be able to achieve and what their life is going to look like, maybe what they can do for their kids or what they can do professionally. And that can be really, that can then influence more kind of emotions and thoughts.
Mm.
And then the last part is the behavior. And so, what can we actually do about it? And in acceptance and commitment therapy, we believe that we really can't control our thoughts. We can't control which emotions we have. We can't really control our sensations. We can manage our thoughts, we can manage our emotions, and we can learn
Yeah.
to manage our sensations.
Okay.
But the one thing we can control is our behavior, sort of what we do about it, what we choose to do. And so that a lot of the work that then I use to kind of help people with these symptoms is around choosing which behaviors, kind of learning how to choose your behaviors according to what's important to you and what you value. So a lot of what we teach is around behaviors that are going to help you kind of get a lot more out of life, but also help you live a life where your breathing is just going to be a little bit easier, a little bit. You're going to kind of treat your body in a way that maybe it's going to be responding well to. So the idea is, again, we want to be really thoughtful about our thoughts, sensations, emotions, and behaviors. And we want to be thoughtful about that kind of leading up to the experience, kind of the trigger. So we want to be like regularly like eating pretty well, sleeping pretty well, not going too heavy on substances, um, eating healthy food, contemplative practice, kind of as like a daily practice.
Mm.
Um, having people around us, kind of finding those things that can help us get in like the best place possible, kind of leading up to it, or just being aware of what was leading up to this
Yeah.
experience. The number of people that I have come in who are coming in after like a bachelor party or a wedding or something where they were just drinking a lot, and then they're getting a little bit older, and then they're getting that kind of anxiety that comes after a night of heavy drinking. And that can sometimes trigger a lot of the same kind of panicky sensations. And so they'll come in and just suddenly have all these experiences. And one of the things we pay attention to is,
Right. What
it,
happened before?
yeah,
What
exactly.
led to it?
And just understanding that so that you at least kind of have more of an understanding of what you're experiencing rather than just like it feels like it just happened out of the blue. But
Yeah.
also sometimes it does just happen out of the blue, and how to handle that. So that it's not like, well, I did everything right. I got
Right.
enough sleep. I'm eating right. Why am I having these sensations?
Right.
It's like we have some control over it for the most part, but not
Right.
always.
Right.
And then we also want to understand all kind of how those kind of happen in the actual present moment of the experience of the, trouble breathing. So we want to understand, what are you thinking, how to kind of slow your thinking down, what's happening emotionally, what's happening with your sensations, and then what are you doing, like behaviorally, what are you doing that might be contributing or helping in
Right.
some way. And then we also then want to think about, well, what can we do about after? How can we think about it in a way that's going to be helpful? How can we, play around with the emotions and kind of grieving it, or just like accepting it, or whatever we want to play around with. And then also kind of any sensations that might happen afterwards, and just kind of leaning into them and different skills around that. So understanding kind of the interplay of thoughts, emotions, sensations, and behaviors, and how that happens kind of leading up to an event, in the actual event, and then how to recover
Right.
afterwards.
And while you're saying all that, I'm thinking to myself, what are my parallels in the medical world? What are we taught? And we don't talk about thoughts at all.
Hmm.
Let me think about sensation. We do. I mean, if it's pain, we'll say, what does it feel like? Or,
Hmm.
is it dull? Is it sharp? Like, these are the words we're taught to ask about pain. But as it relates to breathing, it's not very common that we say, what does the breath feel like? Maybe we do on occasion. Does it feel like you're breathing through a straw? What does it feel like? But it's not as common. And then emotions, certainly not mainstream conversation. We do focus on behaviors. So we will talk about what circumstance were you in? Like, what was the trigger? And were you, as it relates to breathing problems, it would be common questions for triggers are, were you around heavy perfume? Were you around smoke? Was it cold air? Was it dust? These are the triggers that we'll talk about. So I wonder how we could talk about emotion as it relates to your heart, your difficulty breathing in a regular doctor's office. And I'm wondering about why we don't ask that. You and I have talked about the kind of arbitrary split between the mental health, your thoughts and your emotions, and sometimes your sensations, and then kind of the organ function. And I'm still struggling to understand where that dichotomy came from, and how we can try to integrate the two together, which is the whole point of our clinic. But as you're talking about emotions, I'm wondering about how you, or if you worry that there's actually something organically wrong. And when we use the word organically, we mean like, is there actually something wrong with the lung tissue, or is the person actually having a heart attack?
Yeah.
This kind of question. How do you think about that, or how do you navigate that with your patients?
Kind of like how to determine if it's like an actual like
Yeah, because
organic
you
issue.
talk about, for example, leaning in, right? Leaning
Hmm.
into the emotion. And I've heard you talk about that in the context of having a panic attack, for example, like into it. But what if the problem breathing is actually what we call bronchospasm, which is that the airways are kind of getting tight and air isn't flowing in and out well, right? If they are having an asthma attack, how do you navigate that?
Well, I mean, that's the kind of thing where I would probably ask a doctor, like, or I would ask, someone like you, like, listen, I'm going to be teaching them techniques to actually kind of purposely bring up these sensations. And this is something that I'll usually have a patient sort of get cleared again, like with a doctor, and I'll explain to them, like, I'm going to purposely have you hyperventilate. I'm going to
Mm,
purposely have you breathe through a straw. I'm going to purposely have you do things to give yourself a head rush, to get you dizzy and kind of nauseated. Like, I'm purposely going to be triggering these sensations, because the goal of, or part of the goal of treating specifically panic disorder, but really any anxiety disorder that has a lot of strong sensations associated with it. I can, definitely explain more of this, but we actually want to repeat those sensations in a safe and therapeutic environment, so that they can start to learn
I
the
see.
difference between
Mm,
that feeling of, oh, head rush, oh my God, I feel like I'm about to faint, and
mhm,
actually fainting, right? Because it kind
mhm,
of feels the same.
mm,
And if you start getting a head rush and you feel like you're about to faint and you sit down quickly, phew, at least the threat's over, but you actually don't learn then, is that feeling actually associated with actually fainting or some kind of dangerous,
Yeah.
fall or something like that? Or is that something that I purposely bring up? I let myself get a little swoony and spinny.
Yeah.
I don't do anything. And then it just kind of fixes itself, because
Yeah.
that's the cool thing, is that actually our bodies really do, like if you try to fight off nausea all the time and not throw up, it's like miserable, right? Like it's a miserable feeling. But
Yeah.
if we can then learn, we have to be taught, like just lean into it, just kind of let it happen.
Mm.
Once you throw up, I mean, it's not fun, but then usually you feel a lot better. Not always, but for the most
Yeah.
part. So we kind of have to like learn that sometimes vomiting is really, really scary and overwhelming, but actually not vomiting is much more awful than miserable.
Yeah. I mean, it's so interesting that you talk about leaning into symptoms because it's making me think about one particular area of teaching we do around people who have COPD, emphysema, and sometimes with asthma, which is this method called pursed lip breathing, which is where we recognize this vicious cycle that people get into. Something triggers, and which is first, chicken or egg? I mean, who knows? Something triggers your airway to kind of get smaller, what's called bronchospasm, um, or something triggers an emotion that changes kind of the way that you're breathing, and then it triggers this bronchospasm. It's hard to tell cause and effect what comes first, but there is an interplay between the fear, oh my God, I can't breathe, and not being able to breathe. And
Mm-hmm.
then you get shallower breaths and you're not, you're not
Yeah.
exhaling. A lot of these patients have a hard time with air getting trapped in their lungs. And so the faster you breathe and the shallower you breathe, the worse, the more air trapping comes and the bigger your lung gets and it becomes like an inflated balloon that can't deflate. And obviously that's going to make you
Mm.
freak out because now you really
Yeah.
can't breathe. I mean, you started off maybe a little bit of hard time breathing and then it just kind of snowballs, right? So we teach this technique of pursed lip breathing, which is basically where you have to recognize what's going on. And that's why it's so interesting for me when you talk about
Mm.
thought leading up to it, right? You have to be like,
Totally.
okay, this is happening
Yep.
soon enough where you can implement something to break the
Mm-hmm.
cycle, right? So we basically teach people to breathe like this.
Yeah.
And by doing that, you're doing a physiologic thing, a measurable physiologic thing where you're actually giving more positive pressure so that your airways are stinted open and so air can come out in people who have collapsible airways. So it's actually doing something that we can sometimes do with machines like a non-invasive mechanical ventilator machine, giving positive pressure. But it also activates your parasympathetic system and it just kind of slows the whole thing down. And even just that act, right? Just by doing you are by nature slowing down your breathing and allowing for that parasympathetic system to kick in and a little bit of the like letting go. And I think the other thing is the agency, right? Like I can do something about this. Like I actually have a skill, or it's now I am in the frame of mind where I know what my doc told me to do, get my inhaler,
Yeah.
and it's just that we can really help people with to be able to recognize the patterns, right?
Yeah.
Their thoughts that leading up. If we talk in this way with people, we could probably, I'm almost certain we can identify patterns, whether it be patterns in, I mean,
Yeah.
behavior. I mean, you're using behavior in a different way. Behavior meaning the response to the thoughts, emotions, and sensations. In this context, I'm going to say like whether it's that you were standing behind the exhaust fume of a bus in the ice cold air. I mean, that's a
Mhm.
trigger. That's what behavior could you implement to remove yourself from that stimulus, right? But so much of it has to do with not only having the skills, where you and I are going to dive into skills in future conversations, concrete skills of what people can do, but it's really being of aware mind to know that, oh, this is happening,
Yeah.
but early enough, like I said, to be able to implement some of these behaviors that we're going to talk about.
Well, and that's what I think is so cool, is that we can all learn this, right? We all have the capacity to learn it.
Yeah.
And that's really empowering. It's not just like people who are already good at
Yeah.
meditating or whatever. Like, it's like this is something that a lot of people struggle to do, but once you learn, it's really empowering. And then the cool thing is you don't have to then try and work really hard every day at it, it's like, yeah, in the beginning, it takes a while, but then it gets so reinforced by
Yeah.
positive experiences or
Yeah.
sort of like things feeling better, that
Mm-hmm.
then it just kind of, it does get a bit locked in after some practice. It takes a while, but then once you get it down, like it just becomes a lifestyle, which
The
is
cultivation of
really
awareness.
cool.
Yeah.
Yeah, yeah.
So, I mean, so what we plan on doing within SenseMed is not only giving people the tools of like, what do I do when I'm in that circumstance, but also understanding with them, together with them, the triggers, whether the triggers be environmental triggers, which is the area that I'll be talking about with regards to what's in the environment, the air that you breathe, and the nutrition, and the reflux, and the inflammation, and all of those things that
Hmm.
I can actually measure in a lab, to emotional triggers, to conversations, emotional triggers, right? Sensations maybe in our body that we um, are interpreting in a way that's dangerous to us, right? That we perceive as dangerous, that might start a spiral. But very importantly, what we're going to be also working on is cultivating that awareness, that pause, right? That even if it's microseconds of saying, okay, all right, this is going down now. Something happened. It's probably XYZ, right? Or I'm going to now implement my tools, and the method that we are going to help people with is that of contemplative practice. And it doesn't have to be long. And like you said, it's something that reinforces over time and spills out to so many areas of our lives. So the next time we'll talk about a different area of maybe behavioral control that
Hmm.
we have, or tools we have, or some thought processes that we can implement. And we'll pepper in some medical education as well on how to take care of your lungs better.